drinking coffee or tea safe, and what about caffeine intake for CKD patients? If you have chronic kidney disease, you might be wondering if it's safe to keep drinking coffee or tea, especially with caffeine. The good news is that for most people with CKD, moderate amounts of coffee or tea can still be part of a kidney-friendly diet. But there are a few things to keep in mind. Caffeine and CKD, let's talk about this. Caffeine is a stimulant, and while it doesn't directly damage the kidneys, too much can increase blood pressure, which is something you want to manage carefully with CKD. If your blood pressure is under control, moderate caffeine intake, about 1 to 2 cups of coffee or tea per day, is usually fine. But if you're sensitive to caffeine or have trouble with blood pressure, switching to decaf or limiting your intake might be a better option. Potassium in coffee and tea. Black coffee and tea do contain some potassium, but a typical 8-ounce cup of coffee has about 150 milligrams, which is considered moderate. If you drink multiple cups a day, potassium can add up, so it's good to be mindful. Instant coffee tends to have more potassium than brewed coffee, and certain herbal teas like hibiscus can also be high in potassium. Phosphorus concerns. Some flavored creamers, instant coffee mixes, and bottled teas contain phosphate additives, which are absorbed more easily than natural phosphorus. To keep phosphorus in check, stick to plain coffee or tea and use a kidney-friendly creamer like rice milk, almond milk, or a homemade option without phosphorus additives. The best kidney-friendly options: black coffee in moderation, herbal teas except high potassium ones like hibiscus or licorice root, green tea, which is low in potassium and phosphorus, decaf coffee or tea if you're sensitive to caffeine, and avoid high phosphorus creamers or sweetened bottled teas. If you love your morning cup of coffee or tea, you can likely still enjoy it. Just be mindful of portion sizes, caffeine sensitivity to your blood pressure, and added ingredients. Do you prefer coffee or tea? Let me know in the comments, and don't forget to follow for more kidney-friendly tips.